the issue of increased drug trafficking in the region.
Indeed, right? So recently we had reported on the whole Malaysia Airlines pilot getting caught after authorities found at least 26 kg worth of drugs in his suitcase, and there were investigations about that. And these numbers of drug arrests have been kind of recorded. We've seen between January and July of this year, a total of 14 Malaysians were arrested overseas for alleged drug smuggling activities after departing on outbound flights from KLIA. I mean, they include men and women. And also, with reporting, we've noticed there's been an increased trend, hence, the attention on it today.
Yeah, because previously when we covered the story about the pilot, it was from a airport security angle, but because there is this trend of Malaysians and even non-Malaysians going through KLIA to traffic drugs, we thought it's worth exploring that angle as well. So joining us now to talk about this is Palani Narayanan, Director of the Drug Policy Program of the Malaysian AIDS Foundation. Palani, thank you so much for joining us. Now, the case of the Malaysian pilot getting arrested in Indonesia for smuggling drugs was one of several cases, right? Within days, other arrests followed, all of which involved individuals departing on outbound flights from KLIA. Before we get into Malaysia's role in this issue, can you briefly walk us through how drug trade in the world operates and what its current challenges are?
I think this case of the Malaysian pilot and following individuals have actually raised a lot of our curiosity and our questioning around drug trafficking and Malaysia's role in that. I think before we can discuss the specifics of cases, I think it's really important for our Malaysian society to understand the nature of drug trade in the world, so that we can understand what's happening locally. You see, there is a UN report called the UN World Drug Report by the United Nations Office of Drugs and Crime. It's not a perfect report, but every year the UN produces this report to show what's happening in the world. Firstly, what it shows is that the drug trade is one of the most profitable, the most lucrative trade in the world, besides arms dealing and human trafficking. So the amount of money we are talking about here is insane and immeasurable. The second one is this drug trafficking spans all continents in the world at the moment. And the third thing we must understand is that this trade is completely unregulated. They don't pay tax. It's run by ruthless criminals with unlimited resources. They are able to pay off everyone, anyone. They are able to buy submarines and planes to transport drugs. And they are able to eliminate any of the opposition. That's the kind of business that we're talking about here. The UN report says that every year the number of people using drugs and getting dependent on drugs is increasing. Last year's report shows that 64 million people have drug dependency issues, meaning they are craving for drugs on a regular basis. The report also shows that the type of drugs that is being produced in the world is increasing. New and dangerous drugs are coming up every year. And you will see that, 5 years ago, we didn't hear about nitazene or we didn't hear about fentanyl. And suddenly, there is increase in all of these drugs.
Can you help us understand what makes Malaysia attractive as a staging ground for regional trafficking?
The drug trade in the world and in Malaysia is just like any other business, is driven by market forces of demand and supply reduction. So where there is demand, supply creeps in. Where there is supply, they will push for demand to exist. The drug trafficking routes change all the time. And the drug smuggling models, right, just gets more and more creative and ruthless all the time. So countries with good infrastructure and low salaries are particularly vulnerable to trafficking. That's just not Malaysia. It's Western African countries. Now we're seeing, in Western Africa, places like Ghana, which are just starting to have better infrastructure, but their wages are really low. Drug trafficking moves through those countries. Fiji, for example, is also having a huge issue around drug trafficking. In our region, Sri Lanka, Malaysia, Indonesia are all very well positioned in the global map as transit points for the movement of drugs between north and south or east and west. It's just perfectly positioned. I think we need to look at it at a larger picture and say that we are strategically placed, we have good infrastructure, and we have low wages by Western standards or global North standards, and this can be exploited by traffickers.
So specifically, 14 Malaysians have been arrested abroad since January. So what do these numbers indicate? Are more Malaysians getting pulled into trafficking, drug trafficking?
Yeah, that's a good question, right? It does look like that. Every time we see more arrests, we think that more Malaysians are getting involved. But I believe that this number is only the tip of the iceberg. There are many more than 14 Malaysians who are involved in the drug trade. That's the same in many countries. People fall victim to offers by the organized criminals for various reasons. Some are poor and need to feed their kids. Some are in desperate situation owing to along or debts and need money. Some may themselves be dependent and desperate for money to supply their own dependency issues. Some may be coerced or fooled or seduced by the drug dealers and drug traffickers. There are many examples and many reasons as to why people get involved in this. The the increasing number of arrests that we are seeing is also because the countries in our regions are ramping up their surveillance and they're ramping up their drug control measures at airports. Arresting and making examples of these arrests shows these law enforcement agencies in good light. So countries are also responding better to interdictions and to controlling drugs on the borders. We cannot be misled by the numbers. For every arrest of a Malaysian overseas, there's probably about another 10 possibly who get through and go undetected.
Okay, so you touched on this a little bit just now, but I'd like to understand the kinds of people these networks target. I mean, how typical is it that they recruit people who are facing financial debt? Is this a typical profile?
Number one is of course poverty, and people need money. If you have 2 children or 3 children or 5 children, and they are all going to school or going to university, and you only have one person working, husband's in jail, or you will be desperate for money, and that's not number one. Number two is people's own drug dependence. The Malaysian pilot was, when urine tested, had drugs in his system as well, and we don't know what is the background story and what was his motivation being a pilot to take that on. But drug dependency could be one of the reasons, because people who have problematic drug use need to continue to serve their drug dependency. The next reason could be threats or intimidation, coercion or blackmails, and that happens a lot with people. And the other reason could be that social media lifestyle. You can see how a lot of the influencers and demonstrating lifestyles that are beyond our ability to attain them with that large cars and jewelry and this and vacations, and people are seduced by this lifestyle, and you can't pay for it with a 9 to 5 job sometimes that we have. So this is, sometimes a simple way to make a lot of money in a short period of time. So that's really important to understand. And I think if we understand that, then we could start developing some strategies around that.
How should we approach this issue then in a holistic way? Should efforts focus on cracking down on the syndicates or on preventing people from agreeing to transport drugs unknowingly or otherwise?
We cannot rely on just law enforcement to resolve our problems on drugs. There is literally no silver bullet to this problem, to this issue. It means that we need to start looking at it from various different angles, from all different areas of drugs, including supply and demand reduction. Number one, we do need to support our law enforcement colleagues, immigration and police, to do this, to do their job in stopping the drugs from coming into our country and being distributed. We need to support the agency anti-dadak kebangsaan AADK to do demand reduction and treatment. We need to support Ministry of Health to do public health related harm reduction measures. We need to support NGOs and drug user organizations to provide community-based treatments. But we also need to start looking at our drug policies and look at where are our drug policies most effective and what needs to be done to improve this. I think one of the drug policies that we need to start thinking about and consider it really carefully, because it is being recommended by UN, international organizations, international experts, local experts, is policies around regulating drugs and decriminalizing drugs. Regulation of drugs meaning government needs to take charge of these drugs, just like we do with cigarettes and alcohol. Then we can actually control the sale and the use of these drugs. We can control what goes into these drugs. We can control who buys and who doesn't, and what sort of treatment they need, what sort of interventions we can provide. This might be something that is a long-term approach. We need to bring our society, our different members of our society along to think in this way. But we can start with decriminalizing drugs for use and minor possession, meaning those who are currently using drugs should not be ending up in prisons. They should be sent towards public health system. The reason why this will help with supply reduction or with the work of the police is, number one, when people end up going to prison when they use drugs, in prisons, they are literally meeting with drug criminals, other drug criminals. They are meeting with traffickers. They are meeting with bigger criminals who are involved in trafficking and distribution of drugs. So when they come out, they have all the contacts that they have built inside the prison. People, when they don't fear imprisonment, they can come forward early in their drug use to get treatment without fear of going to jail. And when they come early to get treatment, they don't progress to become dependent drug users or addicts, as society badly calls them. But people don't progress into dependency, meaning we reduce the demand for drugs. So we need to look at this as a whole, and we need to make some really bold and courageous decisions. We need to start looking at a new business model when it comes to handling our drug issues.
Okay, so Bukit Aman police said that international drug trafficking syndicates will now potentially seek alternative routes, seeing as KLI enforcement will be tightened. Can you give us a sense of how challenging it is to address these different tactics they use?
So the syndicates, organized criminals, use multiple ways of bringing drugs into a country. There are multiple tactics, right? For example, Fiji is having a severe problem with drugs coming into their country because they are on the way from Mexico to Australia. So drugs are spilling into the country. And if you look at that, drugs are coming through submarines. These criminal syndicates are so rich they can they can use specific submarines to transport these drugs. In Australia, for example, there is a case of drugs being imported through rice packages from Pakistan. You know, like they were put into rice packages and put through the ships to come into the country. In Europe, where I've worked for several years, you know, we see a lot of people swallowing pellets of cocaine and bringing it into the country inside their body. So the tactics used by criminal syndicates are multiple. It's not just one. So when authorities close KLIA or increase surveillance in KLIA, the criminal syndicates will start moving towards other ways of bringing into the country. Kalau bukan dari KLIA, it will be like from the sky or from the sea. So we need to, or from the land, you know, we need to accept that these criminals have so much resources to bring drugs from various different places. So that's really key to understanding this.
So, in closing, then, do you have any final thoughts to leave us with?
I do. It's really critical that we understand the recent increase of drug trafficking as a part of a larger issue that has been going on for many, many decades in our country. We have Dangerous Drugs Act 1952 that governs some of our supply and demand. It's 1952. It was 5 years before Merdeka. It's time we relook at what works and what doesn't. Just like the way the UN has now decided to relook at the conventions on drugs, of which we are very proud that Professor Adiba is one of the UN experts on that panel. While we support our law enforcement, PDRM and immigration, we must also start thinking about new ways of working, because just pouring our efforts and focusing on law enforcement without focusing on demand, without focusing on education, harm reduction, and changing of our laws, we will continue to have these issues happening in the future. So apart from law enforcement, we also need to look at regulating and decriminalizing drugs in our country so that we can be more effective in managing drugs. Most countries in the world have now started to realize that completely eradicating drugs is not something that can happen, but we can control the issue of drugs and the harms done by these drugs to our society. So that's our hope from Drug Policy Program.
Thank you so much, Palani. That was Palani Narayanan, Director of the Drug Policy Program of the Malaysian AIDS Foundation. You've been listening to Top 5 at 5, BFM 89.9.